One of the most pressing questions that people ask after a mesothelioma diagnosis is what their prognosis is. In plain terms, the question is, how long do I have? While this is a natural question, the answer tends to be more complicated than you might think. Prognosis depends on many factors: the type of mesothelioma you have, the stage, your cell type, your overall health, and the treatment you receive. Today, I want to give you honest, realistic information about mesothelioma prognosis while explaining why individual outcomes vary so much. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is definitely not medical advice. But understanding prognosis, it helps you make informed decisions about treatment and planning. So let's start with the overall statistics, understanding that these are averages and many patients do better or worse than average. For all types of mesothelioma combined, median survival is approximately 12 to 18 months from diagnosis with treatment. Median survival means half of patients live longer than this and half live shorter. 5-year survival is another term you need to understand. It refers to the percentage of patients who are alive 5 years after their diagnosis. For mesothelioma, the 5-year survival rate is approximately 10 to 12% for all mesothelioma types combined. This means about 1 in 10 patients survives 5 years or longer. These statistics sound grim, and mesothelioma is certainly a serious disease. But the overall numbers hide enormous variation based on specific factors. First, the type of mesothelioma you have will dramatically affect your prognosis. Pleural mesothelioma, which accounts for about 75% of cases, has a median survival of 12 to 18 months with treatment, including immunotherapy. Some patients live 2, 3, or even 5 years. Peritoneal mesothelioma, which accounts for about 20% of cases, has a dramatically different prognosis depending on treatment. With cytoreductive surgery and HIPEC performed at specialized centers, the median survival is 5 years, and 5-year survival rates reach 50 to 75% at the best institutions. This is 3 to 4 times better than the 5-year survival rate for pleural mesothelioma. Of course, without surgery, peritoneal mesothelioma prognosis is similar to that of pleural disease. It's roughly 12-month median survival. Now, before I go on, I want to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Getting back to prognosis, pericardial and testicular mesothelioma are 2 other types of mesothelioma, but they're both so rare that it's tough to gather enough data to create meaningful survival statistics. Leave it to say that the prognosis for both types, it's generally poor. Cell type is one of the strongest prognostic factors. With treatment, epithelioid mesothelioma has a median survival of 18 to 24 months, and it accounts for about 70% of cases. This is the most favorable cell type you can have. Sarcomatoid mesothelioma, it has a median survival that runs somewhere under 12 months. Frequently, it's under 6 months. It is the most aggressive type, and it accounts for 10 to 20% of cases. Biphasic mesothelioma is a mix of the two, and its prognosis depends on the proportion of epithelioid versus sarcomatoid components. If a patient's tumors are predominantly made up of epithelioid cells, the prognosis is better. If they're predominantly sarcomatoid, the prognosis is worse. Stage at diagnosis is critical. Early stage disease, stage 1 or 2, has a significantly better prognosis than more advanced disease stages. Stage 1 pleural mesothelioma has a median survival of about 20 to 22 months, where stage 4 has a median survival of 12 months or less. Early diagnosis generally reveals a less aggressive disease biology and creates the opportunity for more treatment options, including surgery. Of course, the type of treatment received can dramatically affect outcomes. Patients who receive aggressive multimodal treatment, which is generally surgery plus chemotherapy or chemotherapy plus immunotherapy, survive significantly longer than those who receive no treatment or minimal treatment. For peritoneal mesothelioma specifically, cytoreductive surgery with HIPEC transforms patients' prognosis from months to years in appropriate candidates. For pleural disease, dual immunotherapy or immunotherapy chemotherapy combinations have improved outcomes compared to older, more traditional treatments. Treatment, it should be done at specialized centers as compared to community hospitals. It dramatically affects survival. Mesothelioma specialists at high-volume centers achieve much better outcomes than general oncologists who rarely see the disease. Remember, it's really rare. Age and overall health also influence prognosis. Younger patients generally survive longer than older patients, and patients without other serious health conditions do better than those with heart disease, COPD, diabetes, or other comorbidities. This makes biological sense. Healthier bodies tolerate aggressive treatment better and have better reserves with which to fight the disease. Genetic factors are increasingly being recognized as having an impact on prognosis. Patients with BAP1 mutations have been shown to achieve significantly longer survival. Some studies show median survivals of 5 years or more for BAP1 mutated patients compared to under a year for others. That means genetic testing can provide essential prognostic information. Response to initial treatment is often an excellent predictor of overall survival. Patients whose tumors respond well to first-line treatment by shrinking or stabilizing, they live longer than those whose disease progresses despite treatment. Sex might also play a role. Though the reasons aren't entirely clear, some studies suggest that women have a slightly better prognosis than men. Performance status is a measure of functional capacity that strongly predicts outcomes. Patients who can perform normal activities and care for themselves have a much better prognosis than those who are bedbound or who require significant assistance. What prognosis statistics can't tell you is what will happen to you as an individual. You're not a statistic. Some patients in every prognostic category do much better than predicted. Long-term survivors exist even among patients diagnosed with advanced stage sarcomatoid disease. Their outcomes, they're rare, but they're real. Conversely, some patients with favorable prognostic factors don't do as well as expected. Disease biology has individual variations that are just impossible to fully predict. So, how should you think about prognosis? Use statistics for context and planning, but not for prediction. Understanding that your specific disease characteristics, your cell type, stage, and treatment plan all correspond to particular survival data will help you set realistic expectations, but you definitely shouldn't let statistics determine what's possible for you. Instead, focus on the factors you can control. You can't change your cell type or stage, but you can choose where you're treated, which treatments you pursue, whether you participate in clinical trials, and how you care for your overall health. You can ask your oncologist about outcomes specific to your situation rather than relying on general statistics. Your mesothelioma specialist can give you much more relevant prognostic information based on your specific disease characteristics. Also, check your priorities. Most patients end up happier when they emphasize quality of life rather than quantity of life. Of course, survival time matters, but so does how you feel during the time that you have left. Some patients choose less aggressive treatment that provides a better quality of life, even if it ends up meaning shorter survival. My advice, based on years of contact with victims, is that you should maintain hope while being realistic. Hope does not require denying your situation. You can hope for the best outcome while also planning practically for various possibilities. Remember that new treatments are constantly emerging and that prognosis statistics, they reflect patients who were treated in the past. If you're diagnosed today, you have access to treatments that weren't available 5 or 10 years ago. So your outcomes may be better than historically based statistics would suggest. What questions should you ask your doctor about prognosis? Start with, given my specific cell type stage and planned treatment, what outcomes are typical? What's the range of outcomes, best case and worst case? What factors most influence my personal prognosis? How might my prognosis change based on treatment response? And are there clinical trials that might improve my outcomes? To review, mesothelioma prognosis varies dramatically based on type, cell type, stage, treatment, and individual factors. The overall median survival is 12 to 18 months, but peritoneal patients treated with surgery can achieve a median survival of 4 to 5 years. Epithelioid cell type, early stage, aggressive treatment, and care at specialized centers can all improve outcomes. Remember, statistics provide context, but not individual outcomes. Focus on what you can control and discuss your personal prognosis with your specialist. You can visit mesothelioma.net for more information about prognosis and things that might help your outcomes. Or you can call 1-800-692-8608 and speak directly to one of our patient advocates, or use the live chat feature on the website. As for me, remember to post your questions below, and I'll see you next time.